So, as we get further into our medical stuff, I will say this one right here is a module that I'm constantly reworking because it's trying to put a lot, just trying to put a lot into one module. Medical experimentation, abortion, and how those intersect with morality is some big heavy hitters in the medical field. These probably should be their own modules by themselves. It might be something I do in the future, but for right now, they're together holding hands. So for this one right here, you have your slides as usual. And as you can see, like I said, I'm going to add the slides. Don't worry, they're coming. As you could see, this is a heavy hitter right here. So there's going to be quite a bit with these ones. And here is the other one. Let me close this. Here's the other one. So depending on which assignment you do would depend on which foundational one that you pull from. Because I said these are some pretty heavy ones. Um, and again, our materials here, you're gonna pull the one that you need. I probably should separate these. Again, I'm really frustrated with this module sometimes because it's an organizational nightmare. Your quiz, which I'm not going to go over, is the same as usual. For your assignments, you can see there's quite a few here. So there's a couple of things in here. So there's the abortion one. There's two types of abortion ones on here. There's abortion and social work advocates, and then there's just the ethical use of abortions in healthcare. So was it essay and was it discussion? For this essay right here, we are talking mainly about um, if you're a social or you're a medical representative, a social work advocate, or if you're just someone that's working in the medical field and you need to speak on the behalf of somebody, how do you do that? So you'll discuss your moral framework. Does your moral framework, is it even involved, or should you just completely lean on hospital policy? Do you lean on the laws? So you see, I have different scenarios here that you could play with, and then you could, respond. So this one is going to be an essay, a post, and go. So now here we have discussion. So a discussion, this one is a little different. This one is using an abortion in healthcare for medical reason. And this one, it talks about a dilemma that a healthcare provider has and the channels available for them to use. This could be considered like a forced abortion. A forced abortion is like, let's just say that the person who is pregnant is, maybe 3 or 4 months along. In the hospital's opinion, the baby is dying, and if they had to save the baby or the mother, it's in the mother's best interest to save her, and there's nobody there to speak on the mother's behalf. She could be unconscious. So, how does the doctors proceed on behalf of these patients? So that's one dilemma. There's quite a few dilemmas that are in the materials for you to pull from. Like you could search through these and pull out the dilemma that you want to talk about, but that's kind of what those options are. The other two are going to be in the area of medical experimentation. The first one is a discussion that I'll talk about. So, this one right here is talking about the Tuskegee Airmen. This is one of our most infamous cases of lack of informed consent and the complete robbing of patient dignity in this case. So, what you'll do is you'll read about this case study and then you'll offer your 2 cents on it. So this one is a discussion. We'll talk back and forth with this one. So there is material for that as well. The last one is what we call savior siblings and gene therapy. A savior sibling is when a parent has a child already. They could be two, they could be 10, and they need a medical procedure that they cannot find a match for. So the parents will use IVF to get pregnant quickly and then have a baby that they know will be a genetic match for the other child. And then when the baby is born and at the correct age, they could pull from that sibling and give that to the other sibling. Now, this becomes a huge medical dilemma of, again, informed consent and patient dignity. Have we just created a child that's spare parts? And can the child consent to this fully and understand what's going on? So this has become a big controversy in the last like ish 10 years. So this is an interesting one to talk about as well. So that's what we're doing for this module. It's a heavy one. It's a heavy hitter. Again, I'm not pleased with the organization myself, so it may even look different by the time this video goes out because I would have been playing with it, but the assignments will stay the same. So, all right.